Thank you, Scott, and welcome everybody. It's good to be here as always. Um, so I'm going to talk a few minutes tonight about a topic that I'm hearing in several different ways last week or so, and that's complacency and addiction. So I want to talk a little bit about what that looks like, maybe what it feels like, and more important, what to do about it. So complacency, of course, is that sense of satisfaction or contentment um, about where I'm at, whether things are good or things are good enough. Oftentimes we get to a certain point and we stop pushing beyond that. Um, so we're kind of challenging ourselves. And in early recovery, it's a very different experience because everything in early recovery is new, often exciting. We're kind of waking up. We're seeing potential. We have some hope about change and the change that's possible, that our relationships might be restored, that our lives could kind of get back to normal out of this kind of crazy addictive patterns that we find ourselves in. So there's new people sometimes, as life changes, there's new beginnings. And that sense of new beginning is always kind of a marvelous thing. It's that syndrome of New Year's resolutions, I guess. So, joining a gym on January 1st and last visit was on January 3rd, and then it's over. So I think we fall into these patterns of complacency, and that same thing, of course, happens in recovery. But that early on phase, and with these addictions that we're talking about often, the sex addiction, porn addiction, chemsex, there is this little bit of anhedonia, a little bit of mild depression, if you will, kind of low mood days. But there's also a lot of excitement, and it's the equivalent of limerence in a relationship where you kind of meet somebody and you're kind of think you're falling for them. Everything's kind of exciting and novel and new. And so the problem with novelty is that it inevitably wears off, and that like breaking a new pair of shoes, we have to kind of walk around, and at first it's a very different sensation. We're aware of it, and then after a while we can kind of get comfortable with it, and perhaps too comfortable. So what does that look like? How does that translate complacency into recovery? A couple different behavioral issues that I see. One is meetings taper off or stop altogether. People think, well, I'm doing okay, I don't need a meeting, or things come up and they never get to meetings. And so we start to lose our connection with program and with our recovery group and even ideals. We may stop doing service. We get less involved. And I think service, as we've talked about before, is a really important way to connect and to not only give back, but like any service, whether it's sponsorship or making coffee or being a greeter at the door in pre-COVID days, that you get more out of that than certainly you give. But it's a really important way of being connected. And the third behavior that I see, we stop being teachable. One of the marvelous things about early recovery especially is that for whatever reason, often painful reasons, we've been kind of cracked open, right? There's a crisis, there's a pending divorce, there's an arrest, there's depression, there's suicide attempts, there's an overdose, whatever it takes to get our attention. And at those moments we kind of break the spell. Those are the moments we are really teachable, where we are open, and that's not an on and off switch. Those moments open up and they close again. And that's why it's so important, I think, when addict has that moment of waking, like, my God, I need help, and they're willing to do that, the moment you don't sit around and think about it, you take action then, because those doors close, and they can close quickly. They can close the next morning. We start to feel better and get back into our rationalizations and our gaslighting and that sort of stuff. How else is, look, we stop working on ourselves. Recovery is not a passive kind of activity. Recovery is a very active process of self-examination, of footsteps. We have to take ourselves to meetings. We have to go and do things and get involved. Many times it involves therapy, but sometimes a group. In addition to our 12-step groups, it involves work and self-examination, because really, as we know by looking at the steps, the addictive behavior, the acting out, is really just the first step. That's giving that up. So we have to really get into it then. And if we stop doing all those things, then our old deceptions start to creep in, old rationalizations, old black and white thinking, old minimizations. It's, my doctor prescribed this, so how bad could it be? We may have circumstances that change. Life keeps going on in recovery. Maybe there's a a loss of some kind or a breakup or something like that that really throws us. So then we're really in trouble. So the risk of relapse is high. We're disconnected and we've kind of done it to ourselves. So what can we do? What are some of the positive steps to do? First of all, I think know when you're in danger. And I think one of the problems with complacency, it can kind of sneak up on us. And it shouldn't, but I like, going to the same meeting so that if I don't show up, people ask where I'm at. I think I've had clients, and I've probably been guilty of this myself over the years, of kind of shaking my meetings up enough that nobody ever knows to expect me. And that's a bad thing, because we need to be accountable and we need to be missed if we don't show up. But how does it feel if we're in complacency? Is it the same old, same old? Is it being bored? Is it things going too smoothly? So really understand how it looks and feels to you. I think if you're starting to experience more triggers and cues, and triggers and cues are probably a normal part of recovery, but if they're starting to happen a lot, if we're getting easily triggered, and so we're combating those things now multiple times a day, something needs to be changed in our program. And it's important here to say that years of recovery don't matter. We can have 20 years, 30 years, 50 years, 100 years. We still have to stay actively engaged. And for me, recovery, and I'm in many years in recovery, it's a constant forward motion. We can't stop, and we have to keep going. We have to keep moving. And I think that's really important to remember. If we're not moving forward, we're essentially moving backward. Second thing, set realistic goals. I think sometimes I've seen people want to kind of rework their life overnight. Many of us have many years of addictive behavior, and it takes a while to unwind all that stuff and really make significant changes in our life. So don't try to change everything overnight, pull everything off the shelf, make all those changes, but really take it in bite-sized pieces. Start small. Go toward bigger things in the change or the working on your life. So how does that look for other kinds of addictions besides, say, porn or sex, where we can sort of cut down? What about food? We see patterns of yo-yo dieting, right? Where people go on drastic weight loss diets, and then they kind of rebound because they can't maintain that. So whatever we do has to really be sustainable in this as well. And I think it has to be reasonable and sustainable. We may need to re-examine our boundary plans during this time. What might need to change? Maybe we need to shift some things around. Maybe some behaviors that we thought were middle circle, or kind of maybe slippery slope, or even outer circle, need to be reappraised. Maybe we need to move something back into the inner circle to really get a handle on it. And then a couple more things. Stay connected, right? We know, and I think probably not a week goes by we don't talk about the importance of connection on this particular webinar, but we really need to stay connected. I think when we start to get complacent, we can start to back off. We go to fewer meetings. We don't make the calls. We tell ourselves we should make the calls. We often remember about the calls, but we just don't get around to it. So I think really making recovery and connection a real priority. And we know that connection is that healing force. The other thing, and I was guilty of this early on too, is to stay around for the fellowship. And this is harder on Zoom meetings, but you don't want to be the first person like out the door when the meeting closes, before you have a chance to socialize a little bit and talk to people and let them know you. And if where I live, very often people go out for a coffee or a meal afterwards, and make a point of going, showing up for that, and really sort of get connected, because that often is where the healing happens, in those meetings, after the meetings. Foster a sense of belonging. In addition to that connection, we know that it's really important to belong somewhere. That's why I think finding a home group, getting a regular set of meetings, and this is not a lifetime commitment. You can shift your meetings around as they change, but I think it's really important to set a pattern of regularity and stick to it. And that also fosters this sense of belonging, like this is a place. And ironically, that often happens very naturally. It certainly did for me. I walked into an AA meeting and knew that I was home somehow, even though I got sober in New York City at this really pretty crazy meeting that I was reminded by someone I met recently who also was sober in New York City at the same time. The meeting slang name was Chock full of nuts. And that was my home group. I felt right at home there. But I think we have to belong wherever we go. And then finally, we keep coming back no matter what. And it's not always going to be easy. It's not going to always be effortless. In fact, it's going to be hard. maybe more days than not in the beginning, and we keep moving forward, we keep coming back. And that's really the essence. You know, the single biggest predictor of recovery, at least from a therapeutic point of view, there's been a lot of therapy studies, is retention. You know, if we just keep people engaged, keep them coming back, that is the single biggest factor in moving into recovery. So I think that's it. Thanks, Scott.
Thanks, David. Just a reminder to everybody, ask questions using the Q&A feature. We've got a couple in there already, but you mentioned, David, I wanted to ask one here, that one of the things that sex addicts might want to do is re-examine their boundary plans or their circle plan. Is that something that they should kind of do on a regular basis anyway? And if so, on what kind of a schedule, and how do they go about re-examining the plan?
Right. So, you know, these boundary plans are, well, at Seeking Integrity, we consider them really kind of contracts. They're formal. They're designed with a lot of thought. Formal to the point of writing them out, signing them, having people countersign them. So they're not something to be changed around on the fly, or sort of shift around or casually. So I think it's important always to, if there's going to be a change, to have it be a discussion with a sponsor and a therapist, or one or the other, or at least some processing of what's going on here, what does that look like, what are the safeguards, what ideas need to be discussed. So if there is a change, it certainly needs to follow that process. However, I would say, and Scott, maybe you have a better perspective than I do, I think we don't want to be changing those very, very often. And I think simply because we don't want to be responding to whims and whimsical kind of changes. But I'm going to defer to you, and if there's a recommended timetable or whatever you think on that.
You know, I've never really thought about it until it just popped into my head. I was like, I wonder how often that examination should happen. I would think an examination should happen at least once or twice a year.
Right.
That doesn't mean you have to change anything. You know, changes are pretty rare. I mean, my sexual sobriety plan, the only changes have been because technology and the world have changed. So I've had to update my plan to reflect what my computer looks like today, as opposed to 20 years ago. But otherwise, my plan is still the same. My problem behaviors are my problem behaviors.
Right.
You know, I just had to realize that, oh, I can do those online too. better make some changes.
Right.
You know, nothing popped out of the middle circle or the inner boundary into the outer boundary suddenly. No,
that's funny how that didn't happen.
Yeah.
When really the changes I've seen with clients are when there's some event or risk or something like that really requires and usually I didn't think this was a problem, but this is a problem.
Right.
And so that requires a change. But I agree, always kind of a regular review of where we're at, but these are not things that are kind of constantly shifting around, for sure. Although they can be changed, but as I say, with a real formal kind of process.
Yeah, if you're changing your plan every other week,
something's wrong.
You're acting out.
Right.
That's not called changing your plan. That's called lying to yourself.
Right.
And the people around you. So yeah. And I just wanted to point out what a lot of what you said is recovery is a program of action. I mean, being in 12-step recovery, being in therapy, these are programs of action. And I know that when I'm feeling complacent, I'm not in action. I'm just stagnating. I'm not growing. And I have to constantly remind myself to grow. I try to learn something new every day. And I don't always succeed, but I try. Because it's an action that I take every day. I just try to learn something new every day as part of my recovery. And if I'm not doing that, and if I'm not doing my 11th step, and if I'm not doing my gratitude list, it's probably because I'm complacent. Everything's okay. I don't need to do it today. You know, and my risk for relapse on those days goes way, way up when I'm not actively working my recovery. So thank you for bringing that up. Okay, let's get to our questions, shall we?
You bet.
So the first one here, what are some boundary self-care responses to lying, or any other advice related to dealing with lying? I assume this is from a betrayed partner, and I'm guessing it's the addict who's doing the lying.
Right. And that's the kind of normal scenario, I guess.
the standard.
Right. You know, lying is just unacceptable from every angle. And I think, you know, that's where boundaries come in. Boundaries about clear communication, honesty, integrity, following through, meaning what you say, saying what you mean, all those kind of things. And if it's not occurring, it's a sign of real, I think, trouble or ongoing trouble in the case of the on the addict's part. So I think confrontation, to start, setting clear boundaries, and have boundaries with consequences. And the thing with consequences, you have to kind of be willing to follow through if you set that boundary. But I think it's just a kind of behavior that's one of those almost black and white things we just can't tolerate. And it's wrong at every level. It's wrong, of course, for the partner, but it's also the addict is really cheating themselves out of integrity and honesty and recovery, because those are old behaviors that are designed really to cover and minimize and rationalize and compartmentalize, and just every kind of bad action is done by that. So I think having those boundaries, having confrontation, I think sometimes it's useful to maybe have the context of that confrontation happen in a couples counseling session, because sometimes it's difficult for a couple who's been through this kind of history not to start reacting with each other. It's very difficult not to kind of get argumentative in those circumstances. And I found a trained third party can be really helpful at kind of clarifying and helping the communication go in a productive way, at least. But I think, yeah, just not being complacent about accepting that, you know, in terms of just really having really clear expectations, and the expectation to follow through and what it's going to look like. I think anytime we see lying, it's not a good sign. And, you know, it goes with the addiction, and I know it's almost, ironically, a lot of people, and some of this is maybe based in trauma, but I think a lot of people lie kind of unnecessarily. It almost becomes a habit. They'll lie almost spontaneously when they don't even have to. And I think so in some extent it's a habit. I think to some extent it's a maybe old maladaptive survival mechanism from growing up with trauma. I don't know what the roots of it all are in every case, but it certainly doesn't work in a life of recovery.
Yeah, and you know, just by the way, to expect an addict to immediately stop lying just because he's been found out is pretty unrealistic, because as addicts, we lie not only to you, we lie to ourselves, and we believe our lies. So it can take quite a while to internally sort out the truth from the BS. That said, active, continued lying, you should absolutely be able to set a boundary around that. Maybe you know, reasonable boundaries early on, because I spent a year hearing something come out of my mouth, and then I have to go, no, wait, that's a lie. I don't even know why I said it. You know, and I just kept, for an entire year or more, I kept catching myself just lying for no reason, as David said. So one of the boundaries I think Dr. Rupp suggested in Out of the Doghouse is, you know, if I lie to you, I have 24 hours to amend the lie. You can still be mad at me. As if I amend the lie, you can still be mad at me about what I was trying to cover up, but not about the fact that I told you a lie. You know, like, that's our agreement. I lied, but I fixed it within 24 hours. That's the kind of boundary you can do early on when the addict is still really struggling. So that's just a thought there. Okay. I have read about all the ways that addicts justify their behaviors to themselves while in their addiction. Addicts have different justifications in a relapse. To me, as a betrayed spouse, the relapses are so much more painful because it's all out in the open now. He can't pretend that these behaviors, the lying, the porn, the drugs, don't hurt me. How do addicts justify relapses to themselves after they've had to confront how much pain and destruction they have caused?
It's a really great kind of observation, and I would say to the question part in there, do addicts have different justifications in the relapse? I don't think so. I mean, I think kind of there's a tool kit of rationalizations and justifications that addicts employ when they're in their disease, and they can be in their disease before treatment or before recovery or in a relapse. It's the same disease. I think it's to get the same behaviors to cover their tracks and to mislead and to gaslight and all those things that are so painful to everyone involved. So I think, you know, some of the things I mentioned, you know, stop and go to meetings, stop doing service, stop being teachable, stop working on themselves in therapy, old rationalizations, all those things can appear in a relapse after recovery, much to the pain of everybody involved. Now, how is that possible? I think, to me, there's a real clear mindset distinction. When someone is active in their disease or in a relapse, whether it's in a pre-recovery or in a relapse, they're really disconnected from a whole set of awarenesses and feelings. And so some of the guys right now at Seek Integrity are having impact letters being read by their partners. And that's one of those moments that once people kind of, the bubble is burst on their addiction, and they can, for the first time, I mentioned being teachable, they're kind of open to understanding and feeling some of the impact they've had on the people they love, and including trauma in every sense. And so, but when we're in that mindset as an addict, you that closes up again. You kind of are in this closed universe of rationalization and minimization and doing your thing and protecting your disease process. So those abilities to have empathy and to be vulnerable and to be trustworthy and all those kind of essential aspects of a relationship that are so critical, those kind of all go away. So not to excuse the addict, but I think when they're in that state, they just lose the ability to really understand not only the impact their behavior is going to have on their wives or husbands or partners or children, but on themselves. Addicts probably fool themselves more than anybody else when they're in that state, with that euphoric recall or remembering the good times and kind of selectively cutting out all the crap that goes with acting out behavior. So yeah, it's just, I think it goes when they're in that space. That's why if somebody has worked hard enough to get into recovery, and it's not an easy thing, right, to face these issues and do all that hard work, it's so much easier to protect it and preserve it by doing the things we talked about, you know, staying for the meeting after the meeting and going to meetings and doing the work and moving forward. It's so much easier to maintain it than it is to reclaim it once you have lost it. And so, yeah, I mean, the fact that the addict kind of drops into their bubble and loses empathy certainly doesn't make it easier on the partner. I understand that. It's still very traumatic and very painful, if not more so, as you point out, because now everything's kind of out in the open. It's very clear what's going on. It's not a mystery anymore. So it's perhaps even more painful. But we do see people, you know, when they get into that addictive process, they kind of go back into that little zone that makes it really hard to connect in an authentic way with integrity with the people they care about.
Yeah, I mean, the whole point of addiction is to lose touch with reality, and that's what we do. You know, our rational brain shuts down, our empathy center, if there is such a thing, shuts down, and the most important thing becomes satisfying our addiction. And, you know, I slipped and relapsed for a couple of years. It's not that uncommon for sex addicts. Not every sex addict slips and relapses, but a lot of them do, and it's painful afterward and sometimes during. But the denial of addiction can be so strong that it can just shut down all thoughts of what you're doing to yourself and the people around you.
Right.
Yeah. How should a partner respond when they see the addict being complacent? Great question.
Great question indeed. So this gets, I guess, a little tricky because I think a lot of times there's a history of involvement on the part of the spouse and encouraging and sometimes detective work and all the things that are normal for the partners of sex addicts to do. And so I think addicts kind of get sensitive to that. And I think sometimes in recovery, Addicts can kind of hide behind doing the work, doing good things, leave me alone kind of behavior. And I think the addict may not want to hear it, but I think it's totally fair for the partner, who probably knows better than anybody else in the world what's really going on, in terms, at least in the confines of a home, to say, gee, this is what I'm seeing. And I think I don't think it's ideal for the partner to be overly involved, because at some point the addict needs to go do their thing, and the partner also needs to get his or her support in the process. But I think it's okay that, to share an opinion. This is what I see. And what I like to have people say is observing a behavior and how it makes them feel. So, gee, I see you not going to meetings for a week, and it's giving me concern, or I have some fear about that, or anxiety, and that's all you're really doing, is pointing out a behavior and how it's impacting you. It's not about, and there's a message, and I guess an implicit message of you need to go to meetings, but it's not nagging. It's not being, it's confrontational, but it's basically saying, this is what I'm seeing, and this is what it's doing to me. But that's really, I think, as much as you can do is point out the behavior and suggest. But I think at some point the addict has to take that responsibility and go for it. And at some point, repeatedly pointing that out will probably lose its effectiveness and create an issue. So part of it is boundaries, including pointing it out, saying, what the behavior is, how it's making you feel, and then at some point letting it go for the moment at least, and seeing what happens with a boundary. And that this is something also, if the couple is in any kind of couples dialogue, or if you have therapists for one or the other, it might be something to bring them to therapy to get some guidance in how to handle this, in terms of confronting it or not confronting it. What are the consequences? What are reasonable boundaries around this, to kind of help you develop it, given your specific situation?
Yeah, the two of you can set some boundaries around how much you get to know about, but your partner, the addict has to recover for the addict. A partner, no matter how much you want the addict to get well, you can't do it for him or her. But I do hear sometimes addicts say, oh, she was trying to micromanage my recovery. And I said, well, what does she want to know? Well, she wants to know, when is the last meeting I went to, and have I talked to my sponsor today, and what step I'm working. And my response is, that's not micromanaging. That's stuff you should be telling her. Right. That's like really basic stuff. Like, when is the last time you went to a meeting? When is the last time you talked to your sponsor? And what step are you on? That's like really basic stuff that you should be sharing with your partner, so she or he knows that, yes, I am doing the work. You don't have to share what you and your sponsor talked about. And probably shouldn't, unless you've agreed with your sponsor that you need to talk to your betrayed partner about something, or therapist, or wherever you are. But but I would echo what David said. You can't do it for him, or her. The addict has to do it on their own.
And just to underscore your point, Scott, it's really the partners have a right to know that the addict is working a program, and they're going to see it through the behavior. But also, I think it's totally reasonable, because more than one addict has said, "I'm going to a meeting," and they're totally going somewhere else. And so I think to really, that's where we expect some integrity, but also the contact, some of those forward motion steps that we talked about that kind of are the opposite of complacency, working the steps, self-care, going to meetings, and all of that.
Yeah, and I've suggested to guys I've worked with, when you get to a meeting, if you have a history of saying you're going to a meeting and then not going, you have an agreement that when you're at a meeting, she will know what the carpet looks like, and you will take a picture of your shoes that you left the house wearing on the carpet, and it will be time-stamped, so she knows you're at the meeting. For me, that's a reasonable thing if you've broken the boundary of saying you're going to a meeting and not. There are lots of things that can be worked out. This is all about rebuilding relationship trust. And you know, as the addict, I should be willing to do anything I need to do to rebuild relationship trust, but I'm naturally resistant to that because I like to keep secrets because I'm an addict. You know, so it creates the friction that's in this question. You know, I'm not sure you're doing the work. Are you? You know.
Right.
So next one here, you just mentioned impact letters. I'm a partner working on my impact letter to my spouse. We are scheduling a session to share it in the next 2 to 3 weeks. My therapist tells me it is beautiful and from the heart, not blaming and shaming, but I still wonder if my husband is far enough along in his recovery to not get defensive. And even though I know on some level I need to share the hurt and pain, I'm still worried it will overwhelm my spouse. I believe my husband's therapist will help prepare him, but how can I prepare myself if he has a hard time or withdraws or even worse, gets defensive in the hours, days, or weeks after I share it? Good question.
Yeah, great question. And, you know, I think it's important that you're so thoughtful about this. I think just to the consideration. However, I think it's really one of those situations where you have to uh, assume that your husband and the therapist are preparing adequately for him to hear it. You know, the impact letter, whether it happens in the context of treatment or outside of treatment, is an incredibly powerful and effective means to kind of help reestablish that communication and to help heal the relationship. And most people, when they're in those teachable moments, right, in recovery, and I assume if he's doing the work with a therapist and going to meetings, that he's in that space where he's open to hearing this, or his ears are open and his mind is open, his heart is open. And I think to some extent you have to kind of write what you need to say from the heart, as it sounds like you've done, and trust that the message will get through with love, and it'll be heard, and that he'll have the ability to process it and take from it what he needs to take and move you both forward on a healing journey. These letters are incredibly powerful, and they carry tremendous healing potential. And I think, you know, I can understand your concern, but I also think that if you've carefully written this, and it sounds like you have, and it's been read by someone else, which is great procedure, and they say it's from the heart, then I think at some point you have to turn that over and release the concern about that and go ahead and do it, and trust that your partner will have the capability to understand it and take it as it was meant. And if he has problems with it or complications or reactions, you both, it sounds like, have support systems that can help you process that. You know, and some, it's, I guess, similar in some ways to the formal disclosure, right? But it's in reverse, where the addict is presenting to his partner what he's done, and the stories about his addictive behavior, and addicts have the same concern. In fact, it's very carefully prepared to make sure that the partner is not more harmed than good, right? That balance between doing good and not doing harm. And so these things are carefully thought out. Honestly, in my experience, when it has the careful preparation like you've done, I can't think of a really bad outcome that I can remember. I mean, there's a difficult, yes. Is it complicated? Yes. But does it serve the purpose of establishing communication and moving the healing journey a little bit farther down the road? I think it does. So it sounds like you've done everything you can. I think it's probably time to let your concern go and move forward.
And this is going to sound so harsh, and I don't want it to, but I'm not sure how to word it. You can't control his reaction. If he has a bad reaction, so be it. You know, you two can process that, each with your therapist and maybe together, but and move forward based on that. If he has a great reaction, great, but you know, it's probably going to be a mixed bag to a certain extent, and that's relatively normal. I remember when I was doing step 9, which is making amends to the people we've harmed, except when to do so would injure them or others. So, and I was worried that, well, what if somebody growls at me and says, I still hate you? And my sponsor at the time said, how the other person reacts is none of your damn business. And he didn't mean it was none of my business. He just meant that I was supposed to be doing that work to clean up my side of the street. And the other person could take the amends or not. I could not control the other person's reaction. All I could control was me doing the work that was going to help me and hopefully help my relationship with the other person. I hope that didn't come off harsh. I mean it in like the most loving way. It's just like, just put it out there. You've got support and see what happens. And don't try to control his reaction or even fret about his reaction. I mean, I know you can't stop yourself from it. It's normal to fret, but does that make sense?
Yeah, and I agree with you. I think at some point we need to speak from our heart and say it, and we do that with love and thoughtfulness, I think at some point then we're powerless over the reaction, and people will hear sometimes what they want to hear. But as I say, in this case, I think you both have support and you're doing the work, and it sounds like there's good intention and good integrity there. So I have a feeling it's going to be fine. But
yeah, and I applaud you for doing this and for running the letter past your therapist. You're doing everything right.
Yeah,
You're just
totally.
doing everything right.
Totally.
So proceed. Okay, I quit my job this week. Despite daily meetings, regular meetings with the mentor, and daily journaling, I have been deep in fantasy porn and masturbation. I realize that I'm trying to escape reality and feelings of uncertainty, loss of purpose, and fear of rejection. I'm aware that my inner child is seeking any way possible to avoid those painful feelings and to only experience pleasure. How is it that I keep coming back to these acting out behaviors? How do I transfer awareness of destructive behaviors to abstaining from destructive behaviors? Great stuff.
Yeah, boy. Wow, there's a lot in there. I guess I'm wondering why you quit your job. If that was to kind of just enable you to dive deeper into your addictive behavior or what. But it sounds like you are taking some of these actions, right? Daily meetings, regular meetings with your mentor, daily journaling, and so on. When I think someone, if you were my client, deep in that, with that kind of struggle, I think that might be a circumstance where you'd want to look at a higher level of care than what you're doing, right? I would recommend a treatment program, honestly, for that. If when you're doing all those things and you still can't control the behavior, and it sounds like it's actually kind of it's worsening, then I would talk to someone about maybe getting more care, where there's more structure, where you can kind of step out of your life for a couple of weeks and get some intensive help, because it sounds like you're doing stuff, and there are points, despite our best intention and really hard work, when we cannot do this by ourselves, or at home with our daily routines or whatever. So I frankly worry. Jobs are sometimes a grounding for us. It gives us structure. It gets us out of the house. So it sounds like there's a little bit of backsliding here. So I think I would consider, if you have somebody to talk to, a therapist, or you can look at us, Seeking Integrity. We can help you maybe talk about that, because I think it sounds like there's some need for more structure there. Now, I want to talk to the second or last part of your question. How is that I keep coming back to these acting out behaviors? And you mentioned inner child, which I've just done a podcast with Eddie Caparucci, who's on sexual relationship healing, about inner child work. It's not out quite yet. It'll be out in a week or so. But this inner child concept is so brilliant, because it really is that wounded part of ourselves, right? That all of us have, usually from trauma or neglect, that is crying out. And when that part of ourselves cries out, we respond with addiction, with addictive behaviors. And so I think when I hear your language there about inner child, what I hear are old hurts and wounds and perhaps trauma that's unresolved, kind of calling out to you with a lot of pain, and you're soothing yourself in that old pain. So I think there's some real opportunity for work here. However, well, I was going to say trauma therapy. of some kind, or to at least explore some of that. However, when you're this active in your addictive behavior, I think it's just, I approach that as more of a crisis situation where you're not rooting around in your childhood. You're very much in the present tense, getting yourself safe, getting yourself some tools, stopping acting out, getting connected to people, getting a place where you belong, really establishing a firmer foundation in recovery before you start doing some of that um, deeper work. Um, and one final question: how do I transfer awareness of these destructive behaviors to abstaining? That's a huge question. It's kind of what we're talking about tonight with complacency, where people have the best of awareness, but they keep tripping up, right? They keep falling up off the wagon or getting in trouble, and it just goes back to me this idea that uh, knowledge is certainly important, but it's not the whole story. And people, there's all kinds of books on addiction out there. You can read. I've had clients come to me they could have had doctorates and all this stuff. They knew far more than I did about different theories and medications and chemical imbalances and all this stuff, and they could not stop acting out. It didn't do them any good. In fact, it made them feel worse because they felt they had all this knowledge in their head and they had a lot of shame about acting out. So it's a combination of knowledge and action. And I think it's that interaction and group process, and it's just not something we can read a book and heal for ourselves. So my point is, it's not just information. It's really information combined with action and engagement in a program. So it sounds like you're making some efforts there, but it's not working, and that's why I think really kick it up a notch and see if there's maybe some more structure and outside help that you can get some better results from.
Yeah, quitting a job, even for the right reasons, and there are right reasons to quit a job, is incredibly stressful and frightening.
Yeah.
So yeah, I mean, I understand why you'd be struggling, but it sounds like you're doing a lot of the right things, as David said, and still struggling. So yeah, a higher level of care. That was my first thought. I was like, yeah. So, all right. I am having a hard time processing what I saw on my husband's dating profiles. It is one thing to hear the facts about what he did, multiple girlfriends and prostitutes. Another to read about what he said he was looking for, his fantasies. Should I be more concerned with what he did or what he fantasized about doing? I haven't had that question before. That's great. I like it.
Yeah. This is one of the complications of doing the great detective work that a lot of spouses and partners do. They sometimes encounter things that are just more upsetting than comforting, trying to, I think, get a sense of safety. They're trying to figure out what's going on, and it can end up really backfiring like this. And I agree with you. I mean, it's one thing to kind of see it in a way that's very vivid and meant to be private and not seen, and there it is, and it's extremely painful and upsetting. Fantasy with addicts, with sex addicts, with porn addicts, with chemsex addicts, it's the game. Fantasy is all about that's really in fact almost the goal sometimes. It's all a head trip. Even if they're acting out with another person, it's oftentimes they're up in their head kind of playing out this movie role of a fantasy. So fantasies escalate, fantasies get off into this unreal behavior. I mean, fantasies for an addict, an intensity addict like sex, porn, chemsex, get really extreme, get really upsetting, certainly for anybody that might discover them, but certainly for the addict for themselves, because they can't kind of believe where their mind is going sometimes. But it's all a search for this intensity that's largely a result of brain chemistry. So long story short, I think I would focus on the behavior. The behavior is what actually happened. There's often a big discrepancy between the behavior and the fantasy. And so I think fantasy is something that kind of has to correct itself. And we had a class today about seeking integrity, about what to do with some of those disturbing fantasies and how you handle them. But I think it's really the behavior that we have to focus on. So I would look at the behavior, I would, again, because this kind of discovery is can be so traumatic, I'd make sure that you have support where you can talk about the feelings that this has caused for you to talk about. And that may be to share that with your partner, your husband, but I think having a third person, especially a therapist or really wise friend who could kind of guide you through some of that, because these are the kinds of things that you need to process your feelings. And it may not be the best thing to process with your addict partner on that. Although I think certainly a discussion about the behaviors is called for.
Yeah, I teach, Jason Swilling and I, we both teach work groups online for, people who can't come to treatment, but still want some help. And they're educational, but one of the classes, I just did this one, I think, a week and a half ago, is how to put together your sexual boundary plan or your circle plan or your sobriety plan, whatever we want to call it. And there's this inner circle, which is the bottom line behaviors, and then there's a middle circle, which is slippery stuff, and then there's an outer circle, which is healthy stuff. And in the middle circle, guys always want to put their fantasies in there, and I have to say, no, it's about behaviors. Fantasies and thoughts that can be triggering that might lead you to your inner circle behaviors go in that middle slippery boundary. The inner boundary for the addict is all about problem behaviors, not problem fantasies. We can't stop thoughts and fantasies from popping into our head. As David said, there are things we can do with them once they get there. I think, but I also think as a betrayed partner, I'd be much more worried about the behaviors than the fantasies. You probably have some fantasies he doesn't know about. And maybe as part of marriage counseling down the line, you can share your fantasies with each other as a way of becoming more intimate. My partner and I have been reading, how did this question get all the way down here? Too early. My partner and I have been reading into the impact of ADHD, that's attention deficit hyperactivity disorder, and hypersexuality. This is obviously only one small factor to the addictive behavior as a whole. With that said, we are curious if you have any experience dealing with ADHD and addictive behavior. We are also curious if it is correlated with the medication, I assume medication for ADHD or the disorder as a whole. I noticed no difference in the change in drive, I assume sex drive, unmedicated or not. Before I turn this question over to David, on September the 17th, I think, or 19th, it's a Saturday, like two and a half weeks from now. We co-host a Super Saturday Recovery Summit with intherooms.com, and we announce it in our newsletter. So subscribe to our newsletter if you don't, and I'll give you the info that way. But Dr. Todd Love is going to be speaking on the interaction of ADHD and addiction. Specifically, he's got a lot of experience with that. He has ADHD and is an addict himself. He has, I think, an online coaching practice. It's Dr. Todd Love, not Troy Love, who's on our website all the time. different Love. But so I definitely mark your calendar with that. Now I will turn this over to David.
That should be a great event, that Super Saturday event. Yeah. So it's interesting, really interesting, because there are some connections between ADHD and hypersexuality. Certainly the impulsivity of the behaviors. Sometimes there's a little bit of obsessive nature to it as well. And I have a whole lot of clients over the years who are fall into the range of addictions we're talking about here, which is porn, sex, and chemsex, or the combined use of drugs and sex, all of which are intensity, exciting kind of chasing intensity kind of addictions. Many of them are self-described as having ADHD. And more of those talk about self-medicating with their addictive behaviors. And interestingly, the literature is sparse actually making the connection, but that's been a consistent report to me over 30 years of work. And I do see, when you look at some of the behaviors or even the medications for ADHD, there's stimulants, they're amphetamines. And amphetamines have kind of paradoxical response sometimes. You'd think it would make people more kind of frazzled and disconnected, but actually paradoxically, they kind of help people focus. And I've had guys report to me, from meth users, for example, and cocaine users report that meth and cocaine actually help them kind of get more organized. Now, the problem with meth and cocaine is that there's so many other powerful things going on. If they even were organized for a while, they get disorganized very quickly. It's not a sustainable model. But I think there is something there. I think the research is just really now starting to take off. One advice I would give is if someone does actually have ADHD, if they're getting medicated for it, to avoid the stimulant medications like Ritalin or Adderall, but go for something like Strattera, which is not an amphetamine, but equally effective at managing symptoms of ADHD. So that's one thing to keep in mind. But I think the other thing I will say, that when an addict starts to get sober, there's often a great disservice done by diagnosing a whole lot of sometimes very serious diagnoses based on their behavior. So I can't tell you how many meth clients I've treated over the years who came to me having been given a diagnosis of schizophrenia or bipolar. And they weren't schizophrenic. They didn't have bipolar disorder. They were meth addicts, but it sure looks like schizophrenia sometimes. And so we really have to kind of get people settle down in their behavior before we make a diagnosis like that. So that's just a caution to everybody. But I think the ADHD is a big problem. I would, the medications, sometimes they help, sometimes they don't. So I don't know what to say about the noticing no difference in the change of sex drive. It does go with the territory sometimes. I suspect if there's no change, then that behavior is really more related to addictive kind of behavior than medication. And that medication is, you may be taking meds for it, but you don't have that really disorder. So it's not really being very effective. It's probably more rooted in addictive behavior. So I'm going to make a note on my calendar to attend that Super Saturday, because that sounds like a really fascinating topic, Scott.
Dr. Rob, I just put this in the chat feature. He did a blog for Psychology Today, I don't know, a month or so ago, looking at the interaction of various mental health disorders and sex and porn addiction. And two of the ones he mentions are bipolar disorder in the manic phase and ADHD, which is kind of a manic thing sometimes, that symptomatically can manifest with hypersexual behavior.
Right.
Now, if the ADHD gets under control with medication, or the bipolar gets under control with medication, and the sexual compulsivity is still there, clearly it's an addiction. If the criteria for addiction are met. But they can kind of drive each other, and sometimes it's hard to figure out which disorder is driving the bus. Sometimes you can, a lot of people self-medicate depression with sex addiction or alcoholism. Does the depression go away when I get sober, or does it stick around? If I deal with my depression, does the addiction stick around? It's really incumbent on a good therapist to diagnose, is it one disorder? Is it both disorders? If it's just one and the other one is symptomatic of that, which one is the one that we need to focus on treating? Because if it's addiction driving my depression, you can treat my depression all day long. It's not going anywhere because I'm still an addict, and that's driving the depression.
Right.
But it's entirely possible to have both. Particularly with the manic disorders, they often manifest in sexual ways.
Hey, Scott, they asked the date. There's Saturday the 12th and the 19th are coming up. So we'll get the exact date before we sign off.
Saturday the 19th.
19th. That's at intherooms.com.
Yeah, and they do not have their announcement up yet because I just sent them to it today. I sent that to them today. But they'll have it up on their website in a couple of days, the announcement for that. And like I said, we'll have it in our newsletter. There's a subscribe button on our website if you're not already subscribed.
And In the Rooms, by the way, if you don't know it, as a platform that has a lot of online 12-step recovery meetings. It also has a chemsex support group that I do on Tuesday nights, and Dr. Rob does a sex addiction support group, I believe, on Friday evenings.
Fridays, yeah.
And it requires a login. You have to create an account, but it's free.
Yeah. It's a nice site. There's a lot of good resources there, and it's free. We kind of initially modeled some of our free offerings after what they were offering, but we were so focused on sex and porn addiction, and then we've started partnering with them on a lot of stuff.
Right.
Which has been great. So we're pretty well out of time here, and we're out of questions. So for once, we timed it perfectly, David.
Good job, Scott.
No, that's all on you. So thank you, everybody, for being here. We will be back next week, same time, same place. And check out all the free stuff on sexandrelationshiphealing.com. We have blogs, we have podcasts, we have daily inspirations, we have all kinds of great stuff. And we also offer, like I said, online work groups. David has a lecture series and work group coming up.
I have a chemsex lecture series coming out for lectures, 90-minute lectures I'll be doing that's interactive with people. That's on Seeking Integrity, where they can find out information about that, correct?
Yeah, I think you can link to it maybe through Sex and Relations, but the easy way to get there is seekingintegrity.com and then click the workshops button, and it'll show you all that stuff.
Great.
So thank you, everybody. We'll see you next week.
Okay, everyone. Thanks so much. Bye, Scott.